All right, welcome back. The month of August is National Immunization Awareness Month. The purpose? To highlight the importance of vaccines of all kinds for people of all ages. The CDC says most children are vaccinated, but many are still at risk for various diseases. Today, our Rosemarie Beltz sat down with a local gynecologist to get parents answers that they need about the HPV vaccine.
HPV is the most common STI. It infects both men and women, and it causes health problems from genital warts to cervical, mouth, and throat cancers. The vaccine has shown to prevent over 30,000 cases of cancer every year. Teen vaccination rates have slightly improved over the past few years, but numbers are not quite what doctors would like to see. I'm here with Dr. Tomlin, who is a pediatric and adolescent gynecologist with Prisma Health, to talk about these statistics. So Dr. Tomlin, what do these numbers tell you as a doctor?
I'm really excited to see that numbers are on the rise, but I definitely think there's some room for improvement here for vaccination for both our young ladies and our young men.
So where do you think we're missing the mark?
I think increasing education and awareness out in the community about the importance of the vaccine is something really important that educators and clinicians can do for families.
What do you think are the biggest myths that you see?
Yeah, I see a lot of different concerns when parents and families come into my office. One of the biggest ones that I hear about is parents are worried because there is sexual contact involved with the transmission of HPV, that somehow by giving this vaccine to their daughters, that it's going to promote or encourage sexual activity. And we have really great research, not just in the HPV literature, but in contraception as well, to show that that just isn't true, that girls are not more likely to go out and have an earlier sexual debut as a result of this vaccine.
Pediatricians say they recommend from 9 to 12 years old to get the vaccine. The CDC shows that some teens get the first round of vaccination, but then it falls off, and parents are reluctant to vaccinate their kids. Again, going back to girls. So if there is a parent out there watching, what advice would you have for them?
I would definitely encourage you to read up and learn about the safety profile of this vaccine. Since its inception and since its FDA approval in the United States, we've given out over 60 million vaccines, and it has one of the best safety profiles of any other vaccine on the market. Side effects are really rare, and the biggest things that we hear about is girls tell us that it tends to hurt, and we have a few episodes of fainting. And so we encourage our patients to just sit quietly for about 10 or 15 minutes after getting the vaccine. But in the grand scheme of side effects, I think that's pretty low.
Is there a resource that you recommend that parents go to?
There's a couple of really good ones. The CDC has a really great fact sheet for parents and for patients that talks a little bit about the HPV vaccine. I also recommend a website called youngwomenshealth.org. It's a website that comes out of Boston Children's but isn't actually written by doctors. So I feel like it's accessible for non-doctors to read about it and learn a little bit more.
Where do you stand on parental consent and the vaccine?
It's a sticky subject for sure, but I will say this, our teenagers have a lot of interest in maintaining their health, and I think that it's really important as a family to encourage your adolescent to be autonomous and involved in their healthcare decision. I definitely have teenagers come to my office asking to get the HPV vaccine, and in South Carolina the age of consent for sexual health services is 16. So I have plenty of young ladies who come to my office asking about this, and I definitely think it's something that should be addressed.
Thank you very much, Dr. Tomlin, for your time, and sending it back to you in the studio.
All right, Rosemarie, thank you so very much. We're going to bring in Daniel Bonds now to get a more detailed check on the forecast over the next 7